All right. Well, good afternoon, everyone. I'm glad that you join us today for our webinar. Let's see, we have about 46 people or so that have joined us so far. First off, my name is Dale Libby. I'm the CEO of the Gathering Place, and we're going to talk for a while today about what we know now about Alzheimer's in 2020. So I'm glad that you've joined us. A couple of things. So I'm going to go through the presentation, and then if you have questions, probably I've got the Q&A thing up. All right. And so if you want to use that, that's fine. You can put your questions in there, or you can put them in the chat box. Okay, either way. But what I was going to tell you all is that I'm going to go through the presentation, and then at the end of the presentation, I'll scroll back through those things and I'll answer the questions that you have. So I'm not going to try to stop during the middle of this and do that, because I'm running this by myself. And the other thing I'm going to tell you is here in a second, I'm going to disappear from the corner up here, and it's just going to be a little black rectangle with my name on it. And that's because I can't move this picture of me out of that spot, and there are some words in these slides that a picture will cover up. Okay, so I'm going to disappear from that. In fact, I'm going to do that right this second. Okay, so now you don't see me anymore, and it just says I'm talking. Okay, so again, thanks for joining us, and we're going to go ahead and get started here. Let me just go down here. Okay, so for those of you that don't know about us, the Gathering Place, we're a 501c3. We've been in business for 13 years now, since 2007, and we provide 42 hours of free respite each month at 10 different churches in Brazoria County for caregivers of Alzheimer's patients. We also do community education and a bunch of other outreach. And so this program that you're participating in today is part of that community education. So we really appreciate you being here today. So we've learned a lot in the last 13 years about early detection, prevention, diagnosis, and treatment of people who have Alzheimer's. And we want to share some of those experiences with you today, okay? So typically what happens is people who have Alzheimer's don't see a doctor for 3 years after the problems are first noticed. You know, it's not unusual for an older person to react to a major life event or an illness with symptoms of dementia. And caregivers generally don't get their loved one to a doctor until erratic behaviors become troubling or the person wanders away. You know, it took 2 years for me to get the correct diagnosis for my wife. And that's because it took us that long to get to a neurologist who knew anything. So sometimes that happens too. So memory loss and confusion are not part of normal aging, okay? And you just have to keep that in mind. That's not what normal aging is about. And one of the values of early detection is that, you know, early testing could find reversible conditions such as urinary tract infections, vitamin deficiencies, or depression. Okay, these things all manifest themselves as dementia type symptoms. Okay, so that's why getting to a doctor early is the right thing to do. Okay, which is what we talk about with the Gathering Place. Okay, so for years, Alzheimer's institutions have really doubled down on pills for Alzheimer's treatment. Here's a couple of quotes from last year. Okay, so the Mayo Clinic talked about working to accelerate discovery with different alliances and things like that. Alzheimer's Association has said, you can read it right here, while there's no cure for Alzheimer's disease or a way to stop or slow its progression, there are drug and non-drug options that may help treat symptoms. Okay, so that's what we've heard over and over and over. Okay, now what I want to say here, we certainly respect the institutions and don't doubt their sincerity, but we disagree on some of those topics. And so this first one talks about the major Alzheimer's groups dismiss landmark observational studies where Alzheimer's symptoms have been reversed because they're not gold standard randomized controlled clinical trials. Okay, now what I want you to know, which is not on the slide, is that while that is certainly true, and there's no doubt about that, I do want you to know that the Alzheimer's Association is starting something called the U.S. Study to Protect Brain Health Through Lifestyle Intervention to Reduce Risk. It's called the U.S. Pointer Study, and it's a 2-year clinical trial to evaluate whether lifestyle interventions that simultaneously target many risk factors protect cognitive function in older adults who are at increased risk of cognitive decline. So this U.S. Pointer study is the first such study to be conducted in a large group of Americans across the United States. In fact, it's being held in 5 different locations, and Baylor College of Medicine is one of them. And so why did they decide to do this? Well, last year at their Los Angeles conference, there was a study from 2014, a large-scale study from Finland in healthy older adults at increased risk of cognitive decline and dementia, reported that a 2-year combination therapy simultaneously targeting physical exercise, healthy diet, cognitive stimulation, and self-monitoring of heart health risk factors had a protective effect on cognitive function. Okay, so what that says is that when they saw that and read that, then they said that excuse me. They said that that's that works, kind of thing. So then the Alzheimer's Association at that program has decided, well, let's see if that really works, and let's do what we would have as a study and do this and see. So what I'm telling you is that I believe that in the next 5 or 6 years, they will come to the conclusion that lifestyle changes really do make a difference, and that they will essentially learn that what we've been doing in our brain camp, if any of you have been to our brain camp since 2011, really does work. Okay, so I'm hopeful that that's what they'll come up with in the next 5 or 6 years. The second bullet here talks about many Alzheimer's researchers have, and more than 1,000 functional medicine physicians worldwide don't think a single pill will ever be effective in slowing Alzheimer's. Physicians are taking a multimodal approach and slowing the progression or reversing symptoms by identifying and treating multiple contributing causes. And that's what we have done. That's what our brain camp is about. Those are the things that we've learned for a while. So just to clarify something in case you don't know, functional medicine is a very individualized and personalized approach to medicine that's a focus on root cause rather than a symptomology of chronic diseases. And so the functional medicine model for healthcare is concerned less with what we call the dysfunction or disease and more about the dynamic processes that resulted in the person's dysfunction. So getting to the root cause of why they have a problem, okay, is what that's about. And so that's what functional medicine is about, okay? So with that in mind then, so here's some quotes from some trailblazing doctors who say Alzheimer's is preventable, treatable, and perhaps reversible. And Dr. Dale Bredesen is one of the people that we use in our information. And his book, which I have right here, is called The End of Alzheimer's. It was published in 2017, and he's done a lot of programs and studies. And so like this first one, he actually reversed Alzheimer's in 9 out of 10 patients. So it was a small study back in 2014. And then 4 years later, they they reversed it in 100 patients at 16 different sites. So it wasn't just his work, it was other works, okay? And really, if you look at this last quote, it says there are ways to prevent Alzheimer's disease. And new findings about diet, exercise, lifestyle, and medication are showing it's possible to reduce your risk dramatically and permanently. And that's what we're trying to get across today, okay? And that's what we want to talk about. So here's some stuff from Dr. Bredesen, okay? And, you know, we agree with him. These are in his book, in some of his studies, that Alzheimer's is actually a disease with some subsets, and they have different causes. They present themselves differently. And so it's important to know this, okay? And so what I wanted to do real quick on this was just give you a couple of comments about each one of these. So inflammatory, you know, that's related to chronic infections like sinus infection, gingivitis, urinary tract infections, viral, bacterial, things like that, okay? The glycotoxic, that's related to high glucose levels or like insulin resistance, things like that. The atrophic, that's related to suboptimal hormone levels, low vitamin D level, and a low insulin level, okay? Toxic is related to high levels of mercury or mycotoxins, which are produced by molds, okay? So that's like household things. Of course, vascular is related to blood vessel issues, and traumatic would be injury kind of related things, okay? So those are the subtypes of categories that he has in his book, okay? And that he's used in his studies and the things that that his work has been based on, okay? And it shows that there's different ways that this happens, okay? Now, about that, healthy habits are key to prevention, and they are also elements of treatment. And so here's a few other quotes. There's a recent study of a big group of people concluded that healthy lifestyles could offset a genetic predisposition. There is real hope for prevention and for treatment of early stage Alzheimer's. The Nun study, which is a book called Aging with Grace by it was a professor, Dr. David Snowden, which was published in 1986, okay, established that people might have full-blown late-stage Alzheimer's with no symptoms. And so 35 years later, after that study began, we know that lifestyle and learning kept the nuns' symptoms at bay. So if you haven't read this book, the library has this. It's an easy read, and it's really interesting because it was a group of nuns that were all together. They were all different levels of education. They all had different jobs in the in the convent, stuff like that. But they followed them all of these years. They did brain autopsies after they died, and they found a whole lot of them who were cognitive right till the end actually had all sorts of, I mean, they had the hallmarks of Alzheimer's in their brains, okay? So it was all about lifestyle and learning, okay? So this is a hallmark study, longitudinal study that's been on forever. And the other one here is about people diagnosed with Alzheimer's caused by simple inflammation might see reversal of symptoms with diet and lifestyle adaptations, okay? So if you remember from the slide before, inflammatory, that was one of the categories, okay? And we've seen this kind of stuff in some of the people that have come to see us, okay? So here's some triggers for Alzheimer's that may be mitigated, okay? And this is important to know, okay? So things like chronic emotional stress or smoking or sleep problems or these environmental toxins that I mentioned earlier, okay? The mycotoxins from mold, Lyme, herpes, and this Babesia, that's a bacteria, okay? Dental and sinus and other chronic viral and bacterial infections, lack of exercise, okay? These are triggers that may be mitigated. I mean, you could stop smoking, okay? You could exercise, you know, and your exercise doesn't have to be that you're at the gym every day and you're working on a six-pack and all the rest of this stuff. I mean, 30 minutes a day walking, that's exercise, okay? So these are things that you could actually mitigate, all right? And the point being is that these insults, which are the things here on the left-hand side, they compound and they reach a tipping point, okay? And it's sort of like the straw that broke the camel's back, okay? And so these things can, when they add up a bunch, can actually cause you some issues, all right? And this is from another Bredesen interview from 2018, okay? All right, let's go here. So what do I want to say? Well, you need to see your doctor, you need to eliminate triggers, and practice Qigong, okay? So let's look at these. Inflammation can trigger Alzheimer's disease, and that's was one of the things on the previous couple of slides. So have you got a chronic sinus infection? Do you have gingivitis? Do you have a low-grade chronic UTI? Do you have a B12 deficiency? Okay, these things can be fixed, okay? You need to learn new things because learning creates new neural pathways and forestalls Alzheimer's symptoms. Okay, that's what we teach in brain camp. Okay, these autophagy, okay, a process called autophagy. Basically, you need about 8 hours of sleep each night. So, you know, if you're sleep deprived, the cells that clean damaged and dead brain cells while you sleep will start destroying healthy cells. So sleep is really important, okay? And 7 to 8 hours is what a normal person needs, okay? Another one, so the compensatory process. If you're hard of hearing, okay, memory and judgment can be adversely affected, and the ability to process sound and speech can be permanently lost unless the hearing loss is addressed right away. So if you're hard of hearing and you have hearing aids, you need to wear them, okay? And let me just tell you, I mean, the way this really works is that if you can't hear what's going on, okay, then what happens is you withdraw, okay, because now you can't understand what's going on. It's hard. I mean, you don't read lips, the whole business. And so you withdraw from what's going on. And when you withdraw from that, it's like being socially isolated. And when you do that, then you have issues that show dementia symptoms, okay? So hearing is very, very important. Chronic elevated cortisol. It plays havoc with your immune system and triggers disease processes. So the cortisol is a stress hormone. So if you are stressed all the time, okay, and it just never ever goes away, that is really wreaking havoc on your immune system. So some of these things like Qigong, yoga, deep breathing, these are all effective in lowering stress. And that's something that you can do and that you need to do, okay? Now, here's some triggers from Alzheimer's that are related to food. So insulin resistance, diabetes, obesity. There's like, okay, so diabetes is one of the risk factors for Alzheimer's, okay? So if you're diabetic, there's a problem, okay? Gluten sensitivity is an issue. Leaky gut, if you have issues inside where your stuff is staying where it's supposed to. Refined carbs, carbs are really bad for you. Trans fats are really bad for you, okay? Just general dysfunction of your microbiome and nutrient depleted diets, okay? So if you're not getting enough nutrients, these are all triggers that are related to food, okay? So up here, the first one talks about foods and some methods of food preparation, like cooking at high heat, charring, can cause inflammation in the gut, triggering disease processes that include diabetes, Alzheimer's, cardiovascular disease, and cancer, okay? So this last one, the worst, sugary drinks, fried foods, sweets, and red meat, okay? So cheeseburger, fries, and a Coke. That's just poison, okay? For more reasons than one, okay? And lots of nutritional people will tell you that. So you have to really be careful. And the stuff is a trigger, okay? And food is a trigger for Alzheimer's, okay? All right, so obesity and diabetes, okay? It's really up in the US because of our diet. And you can see here, the last 70 years, the rate of obesity has increased from 10% to 42.4%. And diabetes rates in that time went from less than 1% to more than 10%. And there's another 34.5% of the population over 18 that has pre-diabetes, okay? And there's a number of nutritional doctors, and they're mentioned here. Dr. David Perlmutter, his book is called The Grain Brain. Dr. Mark Hyman, that book is Eat Fat, Get Thin. And Dr. Neil Breslin's, I already mentioned him, The End of Alzheimer's. And then Dr. William Davis, The Wheat Belly. They blame carbohydrates and the lack of healthy fat in the American diet. Okay, so now the question for you is going to be, so what's a healthy fat? Okay, well, let me give you some suggestions and some examples. Here's a list of foods that contain healthy fats, okay? Nuts, like almonds, cashews, peanuts, pecans, and walnuts. Vegetable oils, olive oil, peanut oil, corn oil, sapphire, sesame, and sunflower oil. Peanut butter and almond butter. Avocado, one of my favorites. Salmon, another one of my favorites. Herring, sardines, trout. Tofu, not one of my favorites. Roasted soybeans and soy nut butter. And then seeds, sunflower seeds, pumpkin seeds, and sesame seeds. So these are some examples of healthy fat. These things need to be in your diet, okay? And really, this other quote from Perlmutter here: we must raise a critically important question. Are carbs, even good carbs, killing us? Okay. So some of the things we talk about in our brain camp and our other program, Medicamp, that started last year, is about a healthy diet. And there's a number of diets that you can be on. I have been on the ketogenic diet. It's not for everybody, but it's worked well for me. And, you know, I lost some weight, which I didn't need to lose because I'm not very big anyway. But I did it mainly to charge my brain up with ketones instead of glucose, because ketones are a smaller molecule and they pass the blood-brain barrier easier than glucose does. And so I've done that, and I've kept the weight I did lose off, and I feel good. And so, you know, I don't eat a lot of carbs. I try to stay away from them as much as I can. And it works, okay? But there's other diets too, Mediterranean diet and things like that, okay? But it's not a cheeseburger, fries, and a Coke. And here's the world's leading Alzheimer's experts agree that low carb diets cut Alzheimer's risk. And Mark Hyman, I mentioned, he says cutting out sugar and refined carbs and adding fat can prevent and even reverse early dementia. Okay. And Perlmutter mentions about 50% of Alzheimer's cases could be prevented if we lowered our blood sugars. Okay. And that's, you know, that's the case. And in fact, I can tell you that in our Medicamp program, we've had people go on a low carb diet who have actually been able to improve their A1C enough that they actually stopped using insulin because they were diabetic. So diet really makes a difference. Okay, it makes a difference in a lot of cases and a lot of things, but it also is a big issue and risk for Alzheimer's. So diet is a good thing for you to do. I did want to make a note here real quick. So I mentioned some of these books. So these books I'm going to read off to you here real quick, and some other resources are in the Brazoria County Library system, all right? So if they're not at your particular library, you can get them through the system. All you have to do is tell them what you want, and they'll get them from whatever library has them. The Aging with Grace by David Snowden, I mentioned that one. The End of Alzheimer's by Dale Bredesen. The Grain Brain by David Perlmutter. Eat Fat, Get Thin by Mark Hyman. And then there's 2 series of DVDs. And if some of you were with us in 2017, I think it was, we had a conference in West Columbia. And that summer we put on at the West of the Brazos libraries and showed some videos from a series called Awakening from Alzheimer's. Okay. Well, the library system has this DVD collection. There's 12 interviews in there. It's called Awakening from Alzheimer's, and you can check it out, okay? And you can watch these interviews with the doctors on these different topics, okay? And then besides that, there's another one called Regain Your Brain. That's a newer version of that, and that's in the library system also, okay? So we have those that are available, okay? Okay, so let's go here real quick. So here's an item about, so 13 years ago, our first Gathering Place client was Abraham, and he was 55. And his diagnosis was unspecified dementia. And so at that time, many neurologists were not familiar with frontal temporal, which is what he had. And he began showing symptoms at age 50. He was still physically strong. He had lost short-term memory and had been nonverbal for about a year. He could still process information, but he did not know how to respond, which frustrated him. Okay. And his caregiver was his 84-year-old disabled mother. And she was on a walker, but she bathed and diapered and fed him. And he died at age 56. So a few facts. 1 out of every 3 people will die with Alzheimer's. Chances are that everyone watching this webinar will either get the disease or be a caregiver for someone who has it. But it doesn't have to be that way. So what you need to do is become informed, okay? Come to the local library in November and get your memory screened. We do that every year in November. If somebody in your family is having memory problems, get them to a neurologist immediately. And then give us a call, okay? Because we've got programs and we can help, okay? So what we want you to know is that Brazoria County could be one of the healthiest in the nation for senior citizens, okay? We have built a comprehensive system of supports for individuals and families, and we earned the Texas Department of Aging and Disability statewide Vision Award in 2015. But we need your help to do more. So what we need you to do is tell your friends and neighbors. Alzheimer's may be a preventable disease. It may be a treatable disease. Some subtypes of Alzheimer's may be reversible in early stages. So don't ignore early symptoms. Get to a neurologist immediately, okay? And you need to go see a neurologist. I mean, we all love our family doctors, but unless your family doctor has been trained for this, they aren't a neurologist, okay? And you need to see a neurologist, okay? And get a complete workup, because then you can find out whether you have any metabolic issues that can be reversed. We mentioned that earlier on, and they'll put you through a number of tests to see where you're going and how you've progressed, and they'll send you to see us, and we've got programs, okay? So here's a kind of a list of our comprehensive dementia services for Brazoria County. So we have our activity socials, okay? I mentioned the 42 hours of free respite, okay, at 10 different churches in Brazoria County every month. And that's an opportunity for participants with dementia to come and go through our program and get stimulation and feel better. And the things we do really work, okay? Plus, it's a time for the caregivers to get away. And these are 4-hour socials and they're free, okay? So we do those. We have, I have a couple of caregiver support groups, one in Angleton and one in Alvin. We have stimulation for the memory impaired. One of our programs is called Early Stage Coaches. That's the one-on-one memory coaching. It's an affiliated program. And we're just starting, in fact, Thursday is the first day for this, some virtual classes for our Alzheimer's patients that we call CompuTalk. And so we're going to have some stimulation classes, half hours at a time on Zoom with the participant and their caregiver. And we're just starting that and to see how that goes, okay? Then we have some other things. Like I mentioned, our prevention classes, Medicamp and Brain Camp. Brain Camp is, we've been teaching lifestyle changes in Brazoria County since 2011, okay? And Medicamp started in 2019 as a metabolic syndrome It's what Medicamp is about. And it's a senior weight loss program. Okay. Early detection. We've had the country's largest memory screening project for community-led organizations for the past 8 years. We also put on caregiver conferences and resource fairs. And we've had several, well, we've had quite a few. I try to do 2 of those a year. Of course, COVID-19 got me this year because I would had one in Alvin in May, but that didn't happen. And we also do special population training, and this is typically our first responder training that we do with the Sheriff's Department, where we work with first responders on recognizing Alzheimer's and other kinds of mental health issues. Okay, so that's kind of our program, and what I'm going to do now is I'm going to stop sharing. I think first I'll turn on the video. Maybe I will. Hang on a second. Okay, there I am. Forgot which box to push. I'm going to stop sharing, and I'm going to look to see if anybody had any questions about what we talked about today, and we'll just kind of go from there and see what we had. Okay, so I've got one question here from Tara. Said she missed the name of the online class for participants and caregivers, and it's called CompuTalk, is what it's called, and it starts Thursday. I think I might have run some things. In fact, I did. I ran some stuff on Facebook, which is probably where some people saw it. It's a 6-week program, I think, and we're going to run it for 6 weeks starting this Thursday, and then we're going to take a week off, and then we're going to do it again August, September, and then we're going to do it again, September, October kind of thing. And see what see what that and see how that works out. Okay, but that's what it's called. It's called CompuTalk, and we're kind of full right now, and so now the answer is you can't get signed up on Facebook. Let me just say that okay, so bear with me on this. Let's get through the first 6 weeks and let's see how it goes. And then we'll put something out again and you'll see it, and then you could sign up again. Okay, but again, this is for participants. Okay, so this is things like music, like exercise, like trivia, like complete the sentence, the rein in blank, things that trigger your memory. Okay, so that's what CompuTalk is all about. Okay, Patricia asked, can we get copies of the presentation? Yes, as a matter of fact, what's going to happen is I've recorded this. All right. And so when we get finished, I'm going to figure out how to post this on our website. And when I do that, then I will send everybody who's on there a list. I'll send you an email because I have all of your email addresses because you signed up. Okay. And I can then send you this link to this thing, okay? And so I'm going to work that out. And once I do that, then it'll be available. And I'm going to do that for the people who signed up but couldn't attend, because I know some of those people. I've talked to some of them. Okay. Da, 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 da. So Jeanette asked about what vitamins and supplements are most effective in reducing inflammation. I'm not a doctor. Let me just tell you that curcumin, okay, the active ingredient in yellow curry, is really good for reducing inflammation. And my wife used to take that. I take it also right now. I take it all the time. I used to give that to her because she had hip problems. Of course, she was overweight like crazy at the time, and but it actually worked on her and helped her hip issue for quite a while. Okay, but I can tell you for a fact that one is real good. Um, other vitamins. I take, golly, I take vitamin D. I take D3. I take vitamin C. I take B12. Everybody should be taking B12. Um, what else do I take? Zinc. I just started taking zinc. Of course, I take a multivitamin too, things like that. But that's kind of, like I said, I'm not a doctor. Okay. So Betty asks, what's the difference between normal age-related memory loss and loss associated with symptoms of Alzheimer's? Okay, well, normal age-related things are things like, for a minute, like you walked out of the room, and like you walked and you don't remember why you went into a room. But if you walk out of the room, all of a sudden oh yeah, I remember. Okay. Well, related to Alzheimer's is you walk into the room, you don't remember why you walked into the room, you walk back out of the room, and then you don't know where the hell you're at. Okay. And you don't know which way to go, and you don't even remember if this is your house. Okay. So that's not normal age related. Okay. And it could be things like, okay, yeah, so I misplace my keys every once in a while, but I find them. Okay. Well, it's when you misplace things and you never find them again. Okay. Or you hid them someplace and you never find them again. Okay. Things like that. Okay. So there's little things we have that we call senior moments, but we recover from them right away. Okay. But Alzheimer's, if one of those things happens to you, you don't ever recover from it. Okay. That's kind of the difference. Okay. It's not very scientific, but that's kind of the difference. Do I have a date for the next Medicamp? Actually, the next Medicamp is full. And we're doing that virtual also. Okay. And so the answer is no, I don't have a date for the next one. But if you want to get on the list, you need to call our founder, Brenda Moss, who started the Gathering Place back in 2007. And her number is 979-849-5051. And tell her you want to get on the wait list for the next Medicamp. It's 4 weeks of lecture, but it's 1 week of lecture, and then it's a support group kind of thing for a week, and then it's another week of lecture, and then so it takes 2 months. Okay. And we're doing it on Zoom. So it's the first time we've ever done it on Zoom, and we'll see how that goes. But we already have our 10 participants. We try to keep it at 10. When we were doing them in person, 10 was a good number because people could bond with each other, and they could, try to keep each other accountable for, losing weight. Well, how did you do this week during those support group things? How did you do this week? Well, I lost, 5 pounds this week. Well, that's great. You know how support group things go. Okay. So this one is already booked. So this is what, July, August. So I don't know. I don't know when Brenda is thinking about having another one, But anyway, you can contact her, or you can send me an email at office@gatheringplacepretoria.org, and we can get you on a list. Okay, but glad to hear that you're interested. It's a good program. Okay. So Richard is asking, my principal care physician has started giving a cognitive test to his patients after they reach a certain age. Good for him. Good for him. We give the mini cognition test, which is what we do at the libraries. It's 6 questions, 9 points. A neurologist will give you what's called the mini mental status, exam, which is 30 points, which is more comprehensive, and that's a better test. I'm not sure what your doctor is giving you, but good for him. I'm glad he's doing that. In fact, I recommend everybody over the age of 50 should see a neurologist. Okay, it's good for them to get a baseline and see what's going on, because part of that baseline is to do an MRI, brain scan, see if your brain's deteriorating, any stuff like that. Okay, so if you have a good baseline, that's the right thing to do. So anybody over the age of 50 ought to be seeing a neurologist. Okay. Let's see, Tara, any insight you can give us on a person with dementia that has had acute delirium state? And let me see what this says. And the delirium state could have been from anesthesia. Yep. Okay, so let me tell you something about anesthesia. Okay, anesthesia is the worst thing you can ever have. Okay, that just throws your brain in the toilet, and it takes forever to recover from that. And depending on your age, sometimes you don't recover from it. Okay, let me just give you an example. So we had a fellow who actually went through our early stage coach program. And he did all the exercises, he did all the things we asked him to do. It's a 10-week program, and everything. And at the end of that, he happened to be going back to his neurologist. And it had been a year since he'd seen his neurologist. And his neurologist gave him his mini mental status exam. And lo and behold, he scored 6 points better than he did the year before. And the neurologist, who had been in business for 25 or 30 years, said, I've never seen anything like this before. Nobody ever comes back after a year and does better. Okay, and I can vouch for that. My wife, only one time did she do a little bit better, and that was when she first had her diagnosis. And then after that, she never ever got any better, quote unquote. Well, so it was ecstatic. Wow, he did a whole lot better. So part of our program did a great job, kind of thing. Well, then he had a little cancer scare, and he had to go in for exploratory surgery, and they put him under for a good long while. And when he came out from being under, everything that he had improved on was gone, and then some. Okay, and it just never came back, and it's just been downhill ever since. So yeah, anesthesia is horrible, horrible, horrible. If you're young and you're not under it very long, you can recover from it. But the older you get and the more it is, it's just awful, just awful. Okay. All right, as part of the routine. Okay. Thanks. So Kathy's still here? Geez, I thought you were gone. Okay, Lana has a question. If person is living in assisted living in No entry or exit from outside people. Doesn't do computer. Barely can talk on landline. Refuses to take meds. How can I, essentially the caregiver, help her now? Okay, there's a tough one. Lana, we've had this conversation before. Um, it's really tough. I guess, well, I don't remember where she's staying right now, but about the only thing you can do for your loved one, since they're locked in there, is to talk to the people at the facility and see if they can do something, with her. I don't know what programs they're having. Um, you know, there's just not, unfortunately, it's just not a whole lot that you can do. It's really up to, it's up to you to have a conversation with the facility and see what they can do to help her. Okay. Yeah, no, I feel your pain. It's awful. My wife, okay, so she died last year, so she hadn't had to mess with this COVID stuff. But we had times where they had the flu really bad, and the place was locked down one time for a month. I mean, I couldn't go in, they couldn't come out, the whole business. And so the people working there, they do the best that they can do. Okay. And that's what you have to do. So makes it really tough. That's for sure. It's unfortunate that she's refusing to take her meds. But yeah, that's that's the only thing I can tell you. Talk to the people at the facility in charge and find out what programs they're doing, what are they trying to do with her, what are they doing with everybody, and if there's any way they can do any more of any kind for her. Okay. And that's about, yeah, it's a sad situation. It really is. Okay. Yeah, it is. It really is tough. Okay. All right. I think that's about all I see right this second, that I've run down. And so what I'm going to do is I'm going to go ahead here in a second and sign off. Now let me check the Q&A. I think there was one thing there, which was, let me go over here. Okay, that's that one. Let me look over here, which I think was, okay. Yeah, so somebody that turmeric and fish oil are both blood thinners and need to be checked with a doctor. Yeah, okay. Especially if you have pre-existing health conditions. If you don't have pre-existing health conditions, they're both actually good for you. I don't take fish oil, but I do eat salmon. In fact, I'm having salmon for dinner tonight. Okay, so omega-3 fatties are good for you, and everybody will tell you that. Okay. All right, so I think that's all I see. So I don't want to leave anybody out. Anyway, so I really appreciate everybody being here today. And like I said, I'm going to work at getting this in a state where I can post it on our website and you can click on it and watch it again. I may even be able to post the slides. I got to think about that. We use GoDaddy for our website, and while it's real easy, there's always a wise guy. While it's real easy to use GoDaddy, they have some quirks. So I have to learn to live with those quirks. We'll do that. All right. So anyway, I appreciate y'all being here. I hope you got something out of this. Really, it's all about lifestyle. It's about diet. It's about learning something new every day. And honestly, we've got programs that we've had success with. And as I mentioned in several of those quotations, doctors around the world, 1,000 different doctors around the world have reversed or slowed cognitive symptoms by doing the stuff that we do. And we do this stuff right here in Brazoria County, and all our services are free. But if you come to Brain Camp and learn what to do and implement that in your life, you can really make a difference in your life, okay? And it really works, okay? And we've had, our own proof here, and you saw some of the stuff that I presented, from 1,000 doctors around the world. The stuff really works, okay? So there is help and there's hope, and that's what we want to get across today, okay? So thanks for joining us, and hope to see you again on another broadcast. Thanks a lot.